Hello, I'm Dr. Emily Richardson, and I've dedicated my professional life to geriatric medicine, caring for patients just like you. Throughout my years of practice, I've discovered something remarkable. Our bodies communicate with us constantly through various signals when something isn't quite right. Sometimes these messages are whispered, but other times they're urgent alarms we simply cannot ignore. Have you ever experienced something unusual in your body and wondered whether it was worth mentioning to your doctor? The reality is that certain warning signs should never be dismissed, as they could indicate your body is facing a serious health crisis. When medical professionals encounter these symptoms, we recognize that potentially life-threatening conditions may be developing. In today's discussion, I'll share with you 6 critical warning signs that medical experts agree could signal serious health emergencies. These symptoms might appear harmless initially, but experiencing them could reveal something crucial about your well-being. From overwhelming exhaustion that persists despite adequate rest to intense, stabbing pain in your midsection, each of these signals represents your body's desperate attempt to communicate that something is wrong. I encourage you to stay with me throughout this entire presentation because this information could genuinely save your life. By recognizing these warning signs and responding promptly, you can take charge of your health before critical conditions progress too far. Let's get started with our first warning sign. If you're finding this information helpful, please take a moment to subscribe to our channel and click the notification bell so you never miss our health updates. Your support allows us to continue creating educational content for everyone. Now, let's continue with our discussion. Warning sign 1: profound, unexplained exhaustion. There's a significant distinction between feeling tired after a busy day and experiencing a level of fatigue that emerges without any apparent cause. If you find yourself completely drained even after sleeping well through the night, or if routine activities suddenly require tremendous effort, your body might be alerting you to something seriously wrong. This type of exhaustion isn't something you can remedy with an energy drink or a brief rest period. It's persistent, overwhelming, and most importantly, it appears with no obvious explanation. Perhaps you once enjoyed gardening in your backyard, but now feel completely depleted after just pulling a few weeds. Maybe everyday tasks like preparing a simple meal, getting dressed, or maintaining a conversation now feel impossibly demanding. This isn't simply a natural part of aging, it could indicate that your vital organs are struggling to function properly. Your heart might not be pumping efficiently, your kidneys could be failing to filter properly, or your body might be diverting energy from normal functions to combat a serious illness like advanced cancer. Medical professionals frequently observe this symptom in patients with serious cardiovascular conditions, kidney dysfunction, or malignancies. When your body is channeling all available resources just to maintain basic functions, profound fatigue becomes inevitable. It's not normal, and it's not something to dismiss. One particularly concerning sign is when this exhaustion appears suddenly or progressively worsens over time. If you previously maintained good energy levels but now feel consistently weak and depleted without clear reason, that's when immediate action becomes necessary. What should you do if you experience this? Pay careful attention to when this fatigue began, what factors seem to worsen it, and whether it prevents you from engaging in activities you previously enjoyed. If it's progressing and interfering with your daily functioning, consult with your healthcare provider promptly. Earlier intervention significantly improves your chances of identifying and addressing the underlying cause before complications develop. Warning sign 2: unexpected severe chest discomfort or pressure. There's one sensation you should never ignore: a crushing, constricting, or intense pressure in your chest region. If this occurs unexpectedly, particularly if it radiates to your arm, neck, jaw, or back, you could be moments away from a serious cardiac event. Medical professionals caution that this type of chest discomfort often signals an impending heart attack or a life-threatening aortic emergency. Many individuals make the critical mistake of dismissing such sensations, assuming they are experiencing indigestion or muscle strain. However, when healthcare providers hear descriptions of this type of discomfort, we take immediate action because delaying treatment can determine whether you survive or experience tragedy. The most dangerous form of chest discomfort feels like an enormous weight pressing down on your chest, making breathing difficult. It might develop gradually and intensify, or it could strike suddenly like an unexpected blow. Either way, it represents your body's urgent call for help. Here's what's crucial to understand: Cardiac events frequently don't present as dramatically as portrayed in television shows. Sometimes the symptoms can be subtle, just a mild discomfort in your chest or upper body combined with lightheadedness, nausea, or perspiration. That's precisely why many people disregard these symptoms until it's too late. If the pain feels sharp, tearing, or as though something is rupturing inside your chest, it could indicate your aorta, the body's primary blood vessel, is beginning to tear. This represents one of the most urgent medical emergencies requiring immediate surgical intervention to prevent fatal internal bleeding. So what action should you take if you ever experience sudden, severe chest discomfort? Don't wait. Don't recline hoping it will subside. Don't convince yourself it's merely anxiety. Contact emergency services immediately. The quicker you receive medical attention, the greater your likelihood of surviving. If you're still following along and finding these insights valuable, please show your support by subscribing to our channel and activating notifications by clicking the bell icon. Your engagement helps us continue providing this potentially life-saving information. Now let's examine our third critical warning sign. Warning sign 3. Breathing difficulty or shortness of breath. Imagine this scenario: you're sitting quietly in your favorite chair, not engaged in any physical activity, when suddenly you feel like you can't catch your breath. It's as if the air has somehow become thinner, and no matter how deeply you inhale, it doesn't feel sufficient. This isn't merely uncomfortable, it's a significant danger signal. Medical experts warn that unexplained breathing difficulties often indicate your body is signaling that something crucial is failing. It might suggest advanced heart failure, a dangerous blood clot in your lungs, or even a silent cardiac event. Many people assume that breathing problems simply accompany aging, but when breathing difficulties appear suddenly or progressively worsen, it's something that requires immediate attention. One of the most life-threatening causes of sudden breathlessness is a pulmonary embolism, a blood clot that travels to your lungs. This can occur without warning, especially if you've been immobile for extended periods or recently underwent surgery. The frightening aspect is that it often begins subtly, perhaps just a feeling of tightness in your chest, before rapidly progressing to a sensation of suffocation. Another possibility is congestive heart failure, where fluid accumulates in your lungs because your heart isn't pumping effectively. This makes breathing increasingly difficult, particularly when lying down. Some individuals even awaken in the night gasping for air. Then there's the often overlooked warning sign, a silent heart attack. Unlike the typical crushing chest pain, this type of cardiac event manifests as extreme breathlessness, nausea, cold sweats, and overwhelming exhaustion. Many individuals don't realize they are experiencing a heart attack until serious damage has occurred. What should you do if you experience unexpected breathlessness without clear cause, particularly if it develops suddenly? Don't panic, sit down, try to remain calm, and seek medical attention without delay. If it's related to a blood clot, heart condition, or serious respiratory issue, prompt action could save your life. Warning sign 4. Significant unexplained weight reduction. Losing weight without trying might initially seem like a fortunate development, until you realize it could signal something seriously wrong. If pounds are disappearing without changes to your diet or exercise routine, your body might be battling something far more concerning than you realize. Healthcare providers caution that rapid unintentional weight loss, particularly in older adults, often indicates advanced disease processes. One primary culprit is cancer. Certain malignancies, especially those affecting the pancreas, lungs, or digestive system, can cause noticeable weight loss before other symptoms become apparent. This occurs because cancer fundamentally alters how your body processes energy, consuming calories at an alarming rate. But cancer isn't the only possibility. Significant weight loss can also indicate severe metabolic disorders, undiagnosed diabetes, or even heart failure. When your body cannot properly absorb nutrients, both muscle mass and fat begin to diminish, leaving you increasingly weak, fatigued, and frail. If your clothing fits more loosely, you need to tighten your belt more frequently, or people comment that you look thinner despite no intentional weight loss efforts. It's time to pay attention. There's another explanation many don't consider: chronic inflammation and infections. When your immune system works overtime combating illness, it burns through energy reserves, causing unintentional weight loss. Conditions like tuberculosis, chronic infections, or autoimmune disorders can deplete your body's resources, leading to unexplained weight reduction. What action should you take if you've lost more than 5% of your body weight in a brief period without trying? This represents a clear warning sign. Don't assume it's simply part of normal aging. Schedule a comprehensive medical evaluation, request appropriate blood tests, and insist on thorough investigation. Earlier identification of the underlying cause significantly improves your chances of addressing serious conditions before they progress too far. If you're continuing to watch and finding this information valuable, please support our channel by subscribing and activating the notification bell. Your engagement allows us to continue creating educational content aimed at improving health outcomes. Now, let's examine our fifth critical warning sign. Warning sign 5, mental confusion, disorientation, or personality alterations. There's something deeply unsettling about feeling your mental clarity slipping away. If you or someone close to you suddenly begins forgetting things, becoming easily confused, or behaving differently without explanation, it could indicate something serious affecting brain function. Medical professionals warn that rapid cognitive decline, especially when it appears suddenly, may signal a stroke, brain infection, or advanced neurological condition. A stroke, for example, can cause immediate confusion, slurred speech, or inability to recognize familiar people and places. Some individuals experience brief episodes where they seem disoriented, then return to normal functioning minutes or hours later. This could represent a transient ischemic attack, often called a mini-stroke, which serves as a serious warning sign that a major stroke may be imminent. Brain infections can trigger sudden disorientation, particularly in older adults. If someone abruptly seems distant, agitated, or struggles with normal conversation, it may not simply reflect aging. Infections can spread rapidly throughout the body, affecting brain function and causing delirium, a state of confusion that can develop overnight. There's also the possibility of Alzheimer's disease or other forms of dementia. While these conditions typically develop gradually, some individuals experience rapid decline, suddenly losing track of time, forgetting recent events, or struggling with previously simple tasks. One common mistake people make is assuming that sudden confusion represents a normal aspect of aging. It doesn't. When brain function deteriorates rapidly, it often indicates an underlying medical condition that could prove deadly if left untreated. What should you do if you notice sudden changes in memory, behavior, or awareness? Seek immediate medical attention. Whether it's a stroke, infection, or another condition, these symptoms require prompt evaluation. Quick action can make a tremendous difference because with brain health, every moment counts. Warning sign 6, severe persistent abdominal pain. A stomach ache might seem insignificant, but when the pain is deep, sharp, or persistent, it could indicate something far more dangerous than simple indigestion. Medical professionals warn that severe abdominal pain, especially when it develops suddenly or continues for hours, may signal that something within your body is seriously malfunctioning. One critical concern is a ruptured abdominal aortic aneurysm, a weakened section of your body's main artery bursting and causing internal bleeding that can become fatal within minutes. The pain typically manifests as a deep, relentless sensation in your stomach, lower back, or side, sometimes pulsating with each heartbeat. In this situation, emergency medical intervention represents your only chance of survival. Another potentially life-threatening cause of severe abdominal pain is intestinal obstruction or ischemia, when blood flow to your intestines suddenly stops. This can occur due to twisted bowel, dangerous blood clots, or even advanced cancer. If your abdomen feels distended, firm, or tender when touched, particularly if you haven't had normal bowel movements recently, this represents a serious warning sign. There's also pancreatitis, inflammation of the pancreas that causes intense pain in the upper abdomen, sometimes radiating to the back. It can develop suddenly and worsen after eating, making even simple meals unbearable. This condition can rapidly escalate, leading to serious complications like organ failure if ignored. Some individuals experience gallbladder attacks, causing sharp, stabbing pain beneath the rib cage, often triggered by consuming fatty foods. Many mistake this for acid reflux or gas, but when the gallbladder becomes inflamed or obstructed by stones, it can lead to life-threatening infections. What should you do if you experience unexplained, persistent, or excruciating abdominal pain? Don't delay. Seek immediate medical attention, especially if accompanied by fever, vomiting, or sudden weakness. Some conditions require surgical intervention, and postponing care could significantly impact your chances of recovery. If you're still following along and finding this information valuable, please show your support by subscribing to our channel and clicking the notification bell. Your engagement helps us continue creating educational content designed to improve health outcomes and save lives. Final thoughts. If you've stayed with me throughout this presentation, you now understand that your body provides warning signals long before catastrophic events occur. The key is recognizing what to look for and responding promptly when something feels wrong. Ignoring these symptoms or assuming they'll resolve spontaneously could prove fatal. We've examined 6 major indicators that may suggest your body is experiencing serious problems. Whether it's unexpected chest discomfort, unexplained weight loss, breathing difficulties, confusion, or severe abdominal pain, these aren't symptoms to dismiss lightly. When something feels abnormal, listen to what your body is telling you. It's always preferable to seek medical evaluation and discover nothing serious than to delay until it's too late. One of the greatest challenges as we age is recognizing that our health status can change rapidly. But here's the encouraging news: being informed empowers you. Understanding these warning signs means you possess the ability to protect yourself and take appropriate action when most critical. You don't need to live in constant fear, but maintaining awareness is essential. I'm interested in hearing from you. Have you or someone close to you ever experienced one of these warning signs, particularly overwhelming fatigue that wouldn't subside? What actions did you take? Sharing your experiences in the comments could help someone else recognize symptoms before complications develop. Here's a valuable practical lesson to remember: never dismiss bodily changes as simply getting older. Pay attention to new or worsening symptoms and communicate promptly with your healthcare provider. Early detection significantly improves health outcomes. Please share your thoughts and experiences in the comments below, and consider sharing this video with friends and family. It could provide potentially life-saving information. If you found this presentation helpful, please subscribe to our channel for more valuable health insights. Your support means everything to us. Thank you for watching, and we look forward to connecting with you in our next video.